Hello, my name is Emily Stewart and this is my initial consultation and needs analysis. Initial consultations are important to obtain information that will help to indicate whether it is safe for a client to participate in physical activity. They also allow specific information to be gathered to identify goals and determine appropriate exercise prescription. This presentation will include the following: the QT Health Clinics near client screen, the PARQ and ESSA adult pre-exercise screening tools, and initial consultation notes. This presentation will also detail a needs analysis, and finally recommendations will be discussed to determine how we will move to the next consult. The new client screen tool identified the client's reason for the appointment was because they aimed to make a comeback to elite level equestrian vaulting. The client believed their main barriers to achieving this goal was their lack of fitness, inability to perform a needle maneuver, and also a lack of discipline with unhealthy snacking. The PARQ and Exercise Adult pre-exercise screening tools are used to identify those at a higher risk of negative health effects from participating in physical activity. Observations show that the client is a 19-year-old female who is 172 centimeters tall, weighs 63 kilograms, and has a body fat percentage of 21%. Both the client's BMI and blood pressure were within the normal healthy range. The client presented as being at low risk due to answering no to each of the pre-exercise screening tool questions and to each of the risk factors as shown. Therefore, it can be reasonably assumed that it is safe for them to begin a physical activity program. Informed consent was also obtained. The initial consultation notes determined that the client is currently participating in 720 minutes of moderate intensity physical activity each week that comprises largely of skills practice, strength training, and vaulting routines. The client also completes 20 minutes of vigorous intensity training once a week and studies full-time, which takes up 30 hours of their week. Therefore, the client is limited in time, and this may present as a barrier to achieving their goals. Keeping all of the previous information in mind, three main practitioner goals have been decided upon. The health-related goals are to increase cardiovascular endurance and hip extensor muscular strength. Skill-related goal is to increase power, and the behaviour goal is to increase awareness in order to decrease unhealthy snacking. Little literature exists for equestrian vaulting, so research on elite level gymnastics was used to form this needs analysis. The aesthetic nature of gymnastics suggests that an individual's somatotype may predict performance. There was a moderately high correlation between high endomorph component and lower scoring teams. This is further supported by a study that found that greater fat mass reduces the strength to mass ratio and hence decreases the efficiency of movement. Hence, a lower fat percentage and increased lean body mass in the arms and right leg, unless excessive, was positively associated with performance. A gymnastics routine lasts approximately 90 seconds and requires a high level of aerobic fitness as suggested by research, revealing a high maximum oxygen consumption and maximum heart rate for both balance beam and rhythmic gymnastics, much like a vaulting routine. Elite gymnasts train for 20.8 hours a week, although largely focusing on complex motor control and the technical aspect of skills, with much less time spent increasing cardiovascular endurance. Finally, the technical movements performed in gymnastics require high angular velocity. It is believed that these athletes achieve this through an increased fascicle length, rather than by having a greater proportion of fast-twitch muscle fibers, which would result in greater cross-sectional area not observed in gymnasts, and also due to the large aerobic demand of the sport. From the initial consult, it was established that the client is able to safely participate in physical activity, and based on their current physical activity levels, there are no indications suggesting that the client could not perform moderate to high intensity exercise. Before prescribing a program, a battery of fitness tests would be prescribed in order to obtain current fitness, power, and strength levels of the client, as each of these components plays a large role in the success of a gymnast and hence equestrian vaulter. VO2 max testing may be used in order to assess whether the client fits in relation to an elite gymnast, and the results of this would inform an endurance-based program. A strength-based program focusing largely on eccentric actions of the hip, knee, and ankle flexors and extensors may then be used to increase fascicle length and hence increase power. A periodized approach would be taken, including a 4-week overloading program followed by a resting period of 5 to 17 days. As research suggests, this is most beneficial from gymnastics performance and hence also equestrian vaulting. To decrease the client's unhealthy snacking throughout the day, the client would be asked to record snacks in a diary to create awareness, and if necessary, the client would be referred onto a dietitian as meal planning is not within the scope of an exercise physiologist.